My main area of expertise is looking at children with visual problems, children who need glasses, children with problems with the retina or strabismus. The other thing I specialize is in looking after adults, so adults with double vision, adults with strabismus, which means when your eyes don't point in the same direction. One of the unique things I offer is strabismus surgery or squint surgery through a small incision, which means we do the whole operation through incision that measures only 2 to 3 millimeters, which means it heals much faster and you get a much better cosmetic result. The majority of my work consists of looking at children with eye problems and adults with double vision or squint, which is when the eye tends to drift in or drift out. So for children, we offer the full range of assessment, which includes assessing their vision, assessing their 3D vision, assessing how well their eyes work together, assessing the power of their glasses, to look at the back of the eye to make sure they have no abnormalities. The most complex, the most successful cases are those where there's a challenging situation, you're able to take the whole family with you and get a good outcome. I remember one of my most complex cases was a baby born by IVF here at the Portland, and was a very precious baby that was born after a lot of treatment, and this baby had a big squint, so the eyes were pointing inwards and the parents were very concerned. They were not keen on having an operation for it because the baby had many other medical issues, and I remember we having lots of meetings about it. In the end, we treated the baby using just Botox injections, so just an injection in the muscles without an operation. Actually, this baby did very well. They have nice straight eyes and got it written up in the newspapers actually. So the most important thing when you see a squint in a child is to carry out a very detailed check for the glasses. Do they need glasses? Because a lot of squints can be treated just with the appropriate prescription of glasses. If that is not enough, or sometimes you need to supplement it, you can use patching, in which case you patch one eye. So if you find that only one eye is squinting, that means probably that eye has less vision, so you end up patching the other eye to improve the vision in this eye. You don't need to patch for long. Up to 2 hours a day will do for the majority of cases. Now, if that is not enough, you can use Botox for some kind of squint, and as a last case scenario, you can use surgery. Squint surgery actually is very safe. It takes about half an hour to perform. You don't have to stay in, you can go home on the same day, and most people have a very good outcome. One of the commonest retinopathies in children is retinopathy of prematurity, is in children born prematurely. In the UK, we screen all children born before 32 weeks of age, less than 1500 grams, to see if the retina is developing normally. The reason this happens is the way our retina develops is by using the demand inside the body for the oxygen to make the vessels grow. If you're born prematurely, this growth stops, and eventually it has to restart. It's restart in an orderly manner. So that's what we look for is when we look for retinopathies. The other common causes of retinopathies can be genetic disorders with the retina, so you can get families in which there is a history of loss of vision, and if that's the case, again, the children need to be detected and treated early on, because now we have a lot more genetic therapies that we did not used to have. So aniridia is a condition in which you don't have the colored bit of the eye. The colored bit of the eye is very important because it acts like an aperture of a camera. It sort of switches off the amount of light we get, which is what makes you able to go from a light to a dark room and be able to adapt. Now, you can imagine if you don't have that iris you get, it makes it very difficult to do that. Also, we know that if you have aniridia, the front of the eye does not develop as well as it should do. So it is quite a complex problem. It's a genetic problem. It happens because of a problem with the PAX6 gene. So what we do for it depends on how it presents. So for example, if you're missing only part of the iris, then you can either stitch together the rest of the iris, or now you can get implants that can be inserted to give an artificial iris. There are certain things I provide that are quite unique. For example, small incision strabismus surgery, which has been very, very popular, and I feel by doing this we reduce the amount of redness and swelling after the operation, so people settle sooner and they have a much better cosmetic result, and that's one of the unique things we can offer. I think the other thing we offer is working in Europe's biggest private pediatric hospitals. So everything you see here is child-centered. We have excellent pediatric theatres where we have pediatric trained anaesthetists and pediatric trained nurses, so you know your child will always be in a safe environment, will be looked after.